My name is Eugene Rodriguez. I'm a trauma surgeon. I've been here in this community for about 27 years. I participate in assisting in the organization of the trauma center that we have in Del Rey, which is actually one of the high centers in trauma in the nation. We've been the sample of trauma centers, level 1 through many states. I get involved in hyperbaric treatments in one day by accident. I didn't know anything about what that was until I realized patients of mine have been taking them. It's a treatment that is not offered through any insurance. It's not covered. Not even the VA hospital considered to pay for that. So that's why there's a foundation to take care of wounded patients, which is we have the honor to have Hillary here today, for which she's going to talk about that. You are in a particular situation because you are trainers, coaches, coach, and you're going to see patients that are going to have a head injury and those patients sometimes need treatment with hyperbaric oxygen treatment in the chambers as a last resort modality, in which it should be really the first modality. We as physicians, we don't know exactly what's going on with the brain, neither neurologists, neither neurosurgeons. So they are realizing to this day, in the last few years, that there's a lot of people with brain injuries that they're really getting the best care in hyperbaric treatments. And I guess that you today will going to have the opportunity to meet two great people that went through all this, so they can really hear to tell you exactly that what we're saying is not something that is not truth. So I hope that enjoy. I'm sorry I have a patient that is going to have a surgery in 15 minutes. I have to go back to the hospital. So I will introduce Hillary Lofton. She's the director of the foundation. And she will be able to tell you all that you need and in front of these good-looking people. Sorry that I'm not coming to get a coach in here. One day I will come and get one trainer for myself. Okay, Hillary?
No worries. Thank you so much, Dr. Rodriguez. We are so grateful to have Dr. Rodriguez on the Howe Foundation board and to be able to work with him and ask him questions and also to call him a friend. So, very excited to be here with all of you, very excited to see you all, coaches, and we are here to talk about the benefits of youth sports and concussion awareness for coaches, trainers, and parents. A lot of you probably are well aware of the benefits of youth sports. That's why you're here, right? That's why you do what you do. So our learning objectives for today are to talk about youth sports, some youth concussion facts. What is a concussion? Concussion symptoms. Very important to know the symptoms. We'll talk about that later. Mitigating concussion risks and making your sport safer, whether it's soccer, basketball, or whatever sport you play and teach kids how to play. What is HBOT? That Dr. Rodriguez talked about, and how does it help concussions? And we'll have some takeaways from our talk, our time together, and then we're going to have an esteemed panel of soccer coaches from Lynn University and soccer goaltender from Big Ten Northwestern.
Yeah, I played in the NFL 16 years, been involved in sports my whole life, and I'm a big believer that athletics teach you lessons in life. And I think every kid should participate in some sort of activity.
Okay, that was Jeff Dellenbach. He's a former NFL player, and he is one of the people that we work with. One of our clients, Mark Super Duper, he's also a former NFL player, Miami Dolphins. Yay, Dolphins. And he referred us to Jeff Dellenbach, and Jeff also coaches football and enjoys doing it, so he's been great to help us out and talk about the benefit of sports for youth. Okay, this is my credential, proud soccer mom photo. That's Patrick. He's my son. And he played soccer in middle school and high school every single year, as well as baseball. And I'm so glad he did. He has so much energy, and he's a really great kid, and it was such a good way to direct his energy, keep him focused, give him a good time with, friends that like doing the same things. And we parents had a great time too, supporting them. I also have my own sport. I've sailed since I was 9, and I started competing in sailing when I was 12. And sailing is a sport. It is competitive, and the great thing about sailing is you can do it forever. I sailed in the Miami Regatta for Columbus Day a couple weekends ago, so those are my credentials. Okay, so you guys are all working with youth, with young kids, and you're giving them the benefits of sports. It's positive, psychological, social, and emotional development that starts at a very early age. And that's what you guys are doing. You're contributing to that. You are contributing to that. So it builds self-esteem, self-confidence, discipline, and work ethic. The kid has to show up to practice, right? And do the exercises that you tell them to do. They have to watch you, pay attention to learn those skills. So those are great assets for a young person. And it's full of positive energy. Some of the other things they learn is calmness and mental toughness. Okay, calmness under pressure. That's so important to know as an adult, right? And you all have that from sports, and you're teaching these kids that, which is really important. Mental toughness we'll talk about later, but it's key for a lot of things in life. You're giving them positive identity as an athlete, especially when they get a little older. If they love the sport, soccer or basketball or whatever it is you're teaching them, especially in their chaotic teenage years, if they have that identity as a soccer player or a basketball player, hey, they love playing it, and they've got that nice coach that gives them some positive feedback and some, correction and is there for them, and all their teammates, they're a team. If they have something happening at home that isn't so great, like maybe somebody's sick or a divorce or job loss or something like that, that kid can continue to function because they have their soccer every week. It's, a great asset for them, or their basketball. So you guys are giving them that too. And teamwork and camaraderie. Teamwork is so important for work and things later in life, and you get that from sports. Also goal setting, right? You're always setting goals in sports. Very important. Okay, there are physical benefits of youth sports too. They're stronger immunity to sickness these kids are developing. An active, healthy kid isn't going to get sick as often, and that will carry on into later life. Weight management, you don't see any really obese kids, right, on the sport playing sports. No, because they're burning off those calories. You're helping them burn off those calories, get healthy, and teaching them healthy habits. Toning of muscles and strengthening their bones, it's going to have positive effects for years to come. It's been proven that if you're healthy and strong, you have good bones and muscles as a child, it's going to make your life much better when you're older. And it helps with cardiovascular endurance and efficient functioning of the heart as well. And big reason why we're all here, why we do what we do, sports are fun, right? It's fun playing sports, yeah, and working with kids.
Benefits to just being a better person, learning things about life, being committed to your teammates. There's nothing better than sports when it comes to that. So I'm an advocate for all sports. And definitely think that there's a place for it, but we do need to be smart about how we do it.
Mm-hmm. Okay, so more benefits of sports, and then we need to be smart about what we do, okay? He played all the sports before he became a football player, enjoyed all of them. And also sitting on the couch with him is Brianna Andrews, who's also from Lynn University, and she was a client of ours. She was recruited to a D1 school for softball, and we'll see something from her later. Okay, here we've got some girls playing soccer. Got the purple team and the home team, and they're all very focused and intent on what they're doing. And I don't know, they may be in high school, maybe they'll be playing for Callie's team for the Fighting Knights in a couple years at Lynn University. And then here we have some boys playing basketball. The same thing. They're focused on that ball. They're all alert. They're ready. They're working as a team. I don't know who's going to get the ball, but it looks it's going to happen. It's very exciting. They're ready for it. Okay, so along with sports and the activity of positive activity of sports, like with life comes risks, right? No matter what we do, things are going to happen. But staying indoors and not participating in sports and activities carries much worse risks. Can anybody think of any risks of not playing sports, of staying inside, and just not playing sports? Yes, in the green shirt.
Gaining a lot of weight.
Yes, weight gain.
Obesity, weight gain.
Yes, obesity. It's an epidemic in our country, and then diabetes in later years. Yeah, exactly. And then what about too many video games? Sitting on the couch leads to isolation and depression, if you're not running around playing sports at the same time, okay? You're just sitting there. And I'm sure there are other negative things too. Does anybody have anything else to contribute? A negative?
Cardiovascular disease?
Cardiovascular disease, yes. They're not getting that exercise. They're not working their heart. They can get cardiovascular disease.
Poor circulation.
Poor circulation, exactly. Yeah, there are so many more risks to not playing sports than to playing sports. That's the key takeaway here. Okay, what about concussions? Concussions are kind of new on the horizon relatively in medicine, as Dr. Rodriguez alluded to, right? My father was a cardiovascular surgeon, the heart. So, back in the day, it was all about the heart. But they were just learning about the brain. It wasn't until 22 years ago that the Congress of Neurological Surgeons in America actually defined concussion. Now, to me, that doesn't seem very long ago. And we're learning more, and 10 years ago is really when they started putting things into play to help people with concussions. The Latin origin of the word concussion actually means violent agitation or shaking of the brain. Our brains are actually very fragile. They're just that jelly, it's a big blob of jelly in our really hard skull. So anytime someone gets knocked around, that our jelly brains are going to go back and forth and get bruised on both sides. And that's how the damage occurs. Okay, here's a visual. Happy little brain, right? Happy little brain. But it's actually like the yolk in an eggshell, okay? And we want to prevent that yolk from getting messed up. And if it does get messed up, we want to help it heal. More about concussions. Okay, these are some facts. The word concussion is used interchangeably with TBI, which means traumatic brain injury. It's a mild traumatic brain injury. Concussions are only diagnosed by doctors, by medical personnel, based on an evaluation of symptoms. The MRI or the CAT scan cannot tell you if you have a concussion. It can tell you if there's bleeding in the brain or if there's a fracture, but concussions are evaluated by symptoms. So it's up to you guys to really keep a close eye on these kids. If there's been a head hit, you want to monitor them for the next week to see if they're getting any symptoms. Okay, some of the words that are important to know are post-concussion syndrome, PCS. What that means, it's persistent neurological symptoms that last more than 3 months. And that does happen, unfortunately. Okay, then there's something called second impact syndrome, which is really bad as well. That is if someone gets a concussion and then the concussion isn't healed and they get another concussion. That's not good. So that's why it's so important to watch your kids and ask them about their symptoms if you see a head hit, and teach them that it's cool. It's good to report their symptoms to their coaches. That's part of being a team player, and that's part of being mentally tough. It's being smart and mentally tough. Not to do so isn't tough, it's stupid. concussions and neuroinflammation. Inflammation is our body's response to trauma. That's what happens when someone gets a head hit, gets a concussion. Okay, a little inflammation is good. If you get a cut on your skin, it's going to start to swell, to slow the blood down, and there are going to be chemicals to keep the bacteria and bad stuff out, okay? That's good. That also happens in the brain, and it can continue, and that's what produces the symptoms. So that's something that we want to work on healing and pay attention to. After a strong head hit, the white blood cells leaking into the brain through the blood-brain barrier, that's what happens. The brain barrier gets a little messed up from that jolting. That causes an inflammatory process within minutes of the injury. This leads to swelling and can also shut off blood flow to that part of the brain, which can cause the cells to either die or to go to sleep, to be stunned. Chronic inflammation can lead to brain degeneration, which can lead to CTE. Has anybody here not heard about CTE? Okay, good, yeah. You hear a lot about CTE, so we want to prevent that. CTE can also be caused, they're saying now, by subconcussive hits to the brain, so just something to know. These are direct or indirect blows to the head, not strong enough to cause symptoms. So we'll talk a little bit about that later, how our sports
There's one by
are
RK2
safer.
and L from 2001.
This is Dr.
There is the
Patel,
Colorado Medical
a
Society
neurologist who
definition,
spoke
and
with
there's
us.
also the American Academy of
For us.
Neurology definition as well.
She's talking about the 3 grades
It kind
of
of boils down into
concussions.
3 different grades of concussion: mild, moderate, and severe. And you can see the differences up there, but some of the key differences are with grade 1, we may have no loss of consciousness, or the loss of consciousness may be short. With grade 2, the loss of consciousness is less than 5 minutes. And in grade 3, it generally is more than 5 minutes, with longer lasting symptoms of amnesia.
Okay, so an important thing here, besides there are different grades of concussions, an important takeaway is that you don't have to be knocked out to have a concussion. That's only a grade 3 concussion, okay? Grades 1, no, not a knockout at all. Just dizzy, maybe, sensitivity to light, sensitivity to sound, more subtle symptoms. That's why we're all here. So you guys can learn about this and monitor it in your kids and inform their parents and educate people and keep them safe. Okay, concussions and youth. Unfortunately, due to their developing brains and immature neck musculature, the kids you guys are teaching that age, ages 7 to 12, are more susceptible to concussions because their brain case isn't fully formed yet than high school students or college students. And high school students are more susceptible than college students. And did anybody know that girls are actually more susceptible to concussions than boys? It's true. And soccer is the most concussion-prone sport for girls, with basketball second. And the reason they think is because girls' neck musculature tends to be less developed than boys. So very important to do those neck muscle exercises. And for the boys too. Boys do get concussions. So for all players, build up those neck muscles to help support that head and the brain. Okay, overall in terms of concussions, soccer follows football, ice hockey, and lacrosse for the most concussions, according to the National Federation of State High School Associations. Basketball has a lower incidence of concussions, but it has more than cheerleading, baseball, and softball, to name a sport. And concussions do happen in basketball.
I had that headache that started from that very first day, and it continued nonstop for 3.5 years. The concussion symptoms came on very slowly, and then progressively, got worse, which was very interesting. I never expected that.
Okay, that is post-concussive syndrome. And can you imagine having a migraine headache every day for 3.5 years? I just can't even imagine it, but that's what can happen. So that's why it's important to keep an eye on those kids and tell their parents to keep an eye on them for a good week and see how they're doing. Because as you heard Brianna say, her symptoms continue to develop. And that's what concussions are, it's the symptoms. That's the only way they can tell. Okay, some symptoms to look for after a head hit. Anybody have any symptoms that they might want to talk about that they might have seen in any of their players? Okay, I'm going to ask you again at the end of this talk because you're going to know what the symptoms are. They're physical symptoms, such as headaches. A headache that lasts more than 5 minutes, because you get bumped on the head, your head's going to hurt. But if it doesn't go away, then that could be a concussion. Dizziness, nausea or vomiting, ringing or buzzing in one's ear, sensitivity to sound, they can't handle sound, loud noises, fatigue, or sleep disturbances, like they can't go to sleep or they sleep too much. Emotional and mental symptoms. If they feel irritable, depressed, or tearful for no reason, or different, feeling frustrated or impatient for no reason, different than their normal behavior. Forgetfulness. They don't remember how they got home and their mom and dad picked them up after you called them and said, hey, your kid got a head hit, it might be a concussion. If they don't remember how they got home, that's probably a grade 2 concussion. Poor concentration, if they can't focus on their studies. Having trouble thinking clearly. If they can't solve the problems they could yesterday or the day before they had their head hit. Super important, if you, the coach, sees any of these symptoms and or suspects a concussion, encourage their parents to get them to the ER or their doctor to be checked out, because that's how they can find out if they have a concussion or not. They will be given physical and cognitive tests and possibly scanned for bleeding or fracture if it was very severe. Only physicians are trained to evaluate and diagnose a concussion. Better to be safe than sorry with the brain, right? Major problems, especially when they get a little older, your little ones probably tell you about every boo-boo and cut and scratch and scrape they have, right? Do they tell you? Okay. When they get older, they don't want to talk about what's wrong with them. Studies show that more than 50% of students who get concussions do not report them to their coaches or parents. This makes it very difficult for them to get the help that they need to recover from their concussion, and makes it more likely that they might get another one. So that's a culture that you guys can build, starting when they're really little, like speak up, tell us what's going on. It's part of being a team player. It's mentally tough to be brave enough to speak up. Some reasons that student athletes don't report their head injury symptoms, they might not know what the symptoms are. Okay, there was a study done of Canadian soccer players and rugby players, and 60% of them reported concussion symptoms, like dizziness, or couldn't see very well, or couldn't listen to noise, couldn't stand noise. But only 22% of those kids knew that it was related to a concussion. So they're reporting the symptoms, but they don't know what has to do with the concussion. So you guys, so you can learn the concussion symptoms and convey them to your kids. If you want, there's a list in this PowerPoint of concussion symptoms. You could keep it with you at all times and just review it. And, there's a handout in here. So if you want a copy of the PowerPoint, just, I have your emails, just let me know and I'll be happy to send you one. Okay, the other reason they don't want to tell is because they want to help their team and not let their team or their school or their family down. Well, you need to look at the big picture. It's your job to teach them to look at the big picture. Okay, if you miss a couple practices in a game, maybe it's better than having to miss the rest of your life, playing sports or doing normal things. So that's mentally tough, right? Thinking of the big picture, that's mentally tough. So you guys can make that happen. Question?
Yes, that's why I coach middle school,
Uh-huh.
high school, and before the season starts, we actually show them a video and talk to them a little bit about concussion. And if we,
Good.
we are, I mean, especially with our school, we got a policy that if anyone we suspect of any concussion, they will not go back on the game, and they have to go and get a clearance from
Right,
their
and we're going to go into that in a minute. Yeah, that's about keeping our sports safer. Thank you. Okay, encouraging students to report their head injury and reducing the possibility of second impact syndrome. As we talked about, start training them now and training their parents. Oh, important to teach them to say head injury symptoms when they're older rather than concussion unless they've been diagnosed with a concussion. Because when they're older, say in middle school or high school or college, a whole protocol is going to go into play. And that doesn't need to happen unless they really have a concussion, and then it needs to go into play. So they need to say head injury. So that's another important thing. Jeff Dellenbach stressed that in his talk. Encourage them to speak up and tell the coach if they see any of their friends with concussion symptoms, or if they see any of their friends having symptoms or having a head hit. If they don't want to tell you, their friends need to tell you. That's being mentally tough. That's being a team. That's how you function as a team. You're all in it together, the coach and all the kids. You look out for each other. You have each other's back, right? So that's part of it. Teach them to speak up. Teach them that part of mental toughness is doing the right thing and taking care of themselves as well as their teammates, so they can continue to have a healthy, active life. Making youth sports safer. Okay, there are protocols that have come into play. As this gentleman was saying, you know, if you get a concussion in middle school, you get pulled out. Same thing in high school, college. You see the physician, and then the trainer will prescribe, you know, how much rest you need. Basically, it's rest is what the usual treatment is for concussion. There's new training for coaches in teaching techniques. I mean, like Heads Up by the CDC and Team Up, Speak Up from the Concussion Legacy Foundation, created in 2012. That's a really good website, the Concussion Legacy Foundation. If you guys haven't heard of it, I encourage you to check it out. You'll learn a lot there. Okay, let's move. Some college basketball players wear headband sensors hooked into a computer to measure the intensity of any head impact, so the coach can know when to pull the kid out. It's kind of cool. There's a blood test being developed by Banyan Pharmaceuticals that will be able to measure immediately if a concussion has happened. That will be so helpful. Okay, we've talked about the problems of concussions. Now we're going to talk about a unique solution, a unique treatment solution that Dr. Rodriguez alluded to, because there are a lot of concussions around. Last year, in 2017, NBC reported that almost 2 million kids suffer concussions every year playing sports like hockey, soccer, and football. That's a lot of concussions. And there's no known cure, as we said, just rest. But the organization that I've been fortunate to find and work with, Howe Foundation, we promote hyperbaric oxygen therapy awareness, and we've seen great success with it for concussions. How does it work? What does it mean? Okay, hyper, more, right? If you're hyperactive, you're more active. Baric, pressure, barometer, oxygen. Oxygen, we need oxygen, right? Our bodies love oxygen. The air we breathe is only 20% oxygen. Hyperbaric oxygen is medical grade. It's 100%. So it gets all that great oxygen into all the cells of your body and all your organs, including your brain, through the pressure, through that pressure. It's pressure of being like 17 to 33 feet under the water. That's how it works. Okay. Two kinds of concussions that we're going to bring up to you for healing. One is an acute concussion, The definition of acute varies anywhere from a concussion less than 3 or 6 months, but that's acute, happened recently. One of the doctors that we work with out in Chicago, who has 6 kids, and they're all athletes, she has a hyperbaric therapy center that treats kids between 24 to 48 hours after a concussion, and they can be healed in 3 sessions, which is really amazing. That is really revolutionary, because normally it takes 40 sessions. Like Mark Duper, his concussions were from the 80s. He had to go through 40, 50, or 60 sessions. That's a chronic concussion. It goes way back. It's going to be harder to heal. So something important to know. Okay, this is what the chamber looks like. They put you in a chamber. You can see through it. It's 100% oxygen. It's relaxing. I did it. I had a little concussion. They gave me 5 treatments. It was great. You can watch TV. You can sleep. You're in there for an hour and 20 minutes. You have to be medically cleared and all of that. You can only wear cotton. No chemicals on your body whatsoever.
I personally
Here's Mark Duper talking about his experience.
kind of did a little, some surveys about myself. You know, I took pictures before I went in, and I took pictures after. And I stopped doing the hyperbaric chamber for a while, as much as I didn't do it, and I took more pictures.
He's talking
And
about
like what I
SPECT
see,
scans when he talks
third
about
time.
pictures. Brain.
So, which means I'm going back in the hyperbaric chamber and starting my treatment again. Only reason why I'm doing that is because I do see a difference when I do the chamber. I'm more active, I'm more aware, I want to do more things, I don't want to sleep half the time. It makes a difference. I mean, and I don't know if it's going to work for everybody. I'm just saying that it helps me going in the hyperbaric chamber, so that's why I'm doing it.
So he and his wife are great advocates and ambassadors for us. That was at a first presentation we did last fall in West Palm Beach. So really appreciate him. And okay, now we're going to have a little test. Can anybody tell me 2 concussion symptoms?
Dizziness.
Dizziness, good.
Nausea.
One at a time. Nausea, good. In the back?
Confusion.
Confusion, yes. How about, headache, right? That's so obvious. Sleepiness. Exactly, really good. So I really encourage you to, study those symptoms and look for them in your kids. Watch them if they have any head hits, and teach them to keep an eye on each other and report to you. Always be asking them that. And most important, enjoy your favorite sports and the opportunity to make a positive difference in their lives for the rest of their lives. Okay, now we have our esteemed panel of soccer coaches and legendary soccer goaltender. He didn't tell me that, but I Googled him on the internet, and that's pretty much what it said. Northwestern, probably the best goaltender they ever had. So, no pressure. But, so does anybody have any questions that they would like to ask? Barry?
I have a question. Occasionally at soccer tournaments, my daughter's 12, we do a lot of tournaments, you're seeing the girls with some kind of padding on their head, some kind of headgear apparatus. Do you think that's going to become more prevalent in not only youth sports, but high school, college? Or do you think that's just kind of a one-off situation?
I almost kind of think it's on the tail end. Like, I think it was a little bit more used years ago.
Okay.
That was kind of the hot thing. They went through it for a while. I don't know anything scientifically on it. Just from what I've heard is that they didn't really see a huge benefit to reduce it.
Okay.
So I think maybe that's why they've steered away somewhat, but you still see some of them out there.
All right, thank you.
I think as the research comes out, and we kind of, like she was saying, we're kind of still in an infancy in like what we know about this, really the last decade plus. I think as we learn more, there's different products and things that are going to come out that we're going to try that might be super successful, might fail. But I think as we learn more and more things are going to come out, and who's to say whether it sticks or not. But I think that's kind of the trend there.
Question?
Besides just the impact, is there anything that makes an individual more prone to having a concussion?
That's a really good question, and yes, studies have shown that there are things.
Yeah, and I mean, one thing really important to consider too is once you've had 3 concussions, I believe the statistic is that you're about 66% more likely to get another one. So I know you're talking about something, you know, before that even happens.
Yeah, like diet maybe, or, you know, anything, just
Genetics.
brain, you know, just somebody that
ADHD.
doesn't exercise their brain, you know, ADHD, you know, things like that.
I think
Yeah.
in the youth, the biggest thing is strength. So she was talking about like girls, like development and just the neck muscles. I mean, really, it probably comes down to that and luck, to be honest. You know, a lot of kids will get hit in the head the same exact way, and some have 0 symptoms, and some have, you know, exponential symptoms. I think sometimes coming back to, you know, just some of the basics, proper stretching, strengthening, right?
Conditioning.
You know, at younger ages, a lot of times you see youth where somebody's super overdeveloped, right? You know, huge and then small, and sometimes those things can interact, you know, poorly. But I think just depending on what age they are, continuing to grow their strength, flexibility, and those things definitely play a factor for sure.
In the back?
Sort of a practical reality question. How are the insurance companies looking at HVOT? Because that's the bottom line for so many families.
That's a really good question, and yes, we would really like it to be covered by insurance for concussions and neurological issues like that and post-traumatic stress, so that everyone has access to it. So if anyone, you know, knows anyone that, you know, if anyone knows anybody in the insurance industry, if you have experience with HBOT, you know, please advocate for it, because one of the doctors that we work with, actually Dr. Paul Buza from Melbourne, I asked him if he thought that hyperbarics for concussions would ever be paid for by insurance, and I was prepared for him to say, not in our lifetime. But what he did say was yes, and I said, what makes you think that? And he said he was around before it was paid for diabetic non-healing wounds. It is paid for 13 other diagnoses. And he said that was before the internet. And now with the internet, there's all this information. Everybody knows everything. The veterans are talking about HBOT. The athletes are talking about HBOT. You know, people in the NHL, the NFL, soccer players. So that information is going to put some pressure to bear, and you know, hopefully it will make a difference.
I think too, I mean, there's a lot of people, like she was saying, on the front lines that unfortunately with insurance, you know, healthcare is insurance is so far behind what the cutting edge is, and this is something that really is cutting edge, you know, last decade where it's gained popularity. Unfortunately, the reality is, you know, sometimes that insurance aspect takes a while to catch up.
Yeah, it's usually that
Yeah,
way, experimental.
But there's a lot of people that are fighting for it, and just the same way there's 20-something conditions now covered. I mean, a couple years ago there weren't that many, right? So they're starting to add to that. I think the most important thing just to keep in mind, just from my own experience, you know, a decade later of still dealing with symptoms that I had over a decade ago, is insurance or no insurance, I would have gladly paid, you know, upfront the 3 treatment sessions in the acute phase rather than let it get, you know, to, you know, way more progression. And I'm sure every parent would, you know, feel the same way, that they would find the means if they knew that, you know, enough early on that they could catch it and give their kid their life back. So just something to think about.
Yeah. Good point. Is there another question?
As I know kids, you know, youth probably a little bit different than adults in college, but what the procedures do you take during the games if you suspect, you know?
Well, yeah, actually, I've had several concussions this year with my team, and they've taken it out of the coach's hands. So we have full-time athletic training staff who evaluate. For example, we had a goal scored on us right at the end of the game to tie it up, where a goalkeeper came out and made contact with the player and got hit in the head. And so the athletic trainer came out and evaluated him, and we had to pull him out of the game, so he couldn't play anymore. But also, at the beginning of the season, we get baseline testing, so they have computer testing so they can evaluate their cognitive functioning. And then what happens is once they notice the symptoms, then we go into a protocol. And so they'll take them in and they compare their results on the test, on the baseline test, and they can send them to the doctor, and then they have to have a certain amount of time before they have no symptoms, so they're symptom-free before they're allowed to return. So like last year, we played in the NCAA quarterfinals to go to the Final Four, and we lost one of our players, and he was out for 2 weeks. But luckily, we got him back for the national championship. But he was out for 2 weeks, but they take it out of the athlete's hands, and they take it out of the coach's hands. It's because the athletes want to play. And matter of fact, my goalkeeper was begging our athletic trainer to let him play and continue, and he just absolutely not. They take it out of their hands because what happens. The coaches can establish the culture, and that's what we do, and that's what you all can do is change the culture. When I played, I had a concussion. I was playing. I was an 18-year-old, and I went up for a head ball, and the goalkeeper came out, punched me, and I was unconscious. Got up, went over to the sideline. I didn't know anybody on the sideline. Didn't know my coach, my teammates, and I was out for 10, 15 minutes, and they put me back in. I played the rest of the game. And so if I would have been hit again, then you could have a lot of problems. But it was part of the sport culture. Hey, you got to be tough. You got to be strong. Suck it up. And with head injuries, it's completely different than soft tissue injuries. I mean, you're dealing with life-threatening situations. So it's changed. The NCAA has done a great job of changing it, changing the protocol in intercollegiate athletics, but it's got to start with the kids.
Is that baseline testing now mandatory in all colleges?
Yes, it's
for
part
all
of the
sports?
NCAA. The NCAA a couple of years ago, with all the research that's come out with NFL players. And they started it with football, but they instituted it for all sports.
So you have to have an athletic director who's the neutral person that's going to do that testing.
Exactly.
That's amazing.
But you have to have that.
Wow.
And so I think you're going to see changes in sport continue. I know at the international level with soccer and professional level, there's a mandatory, like if the referee sees a player and he thinks that there's a problem, then the player has to go off. It's not the athlete's decision anymore.
Well, and they can stop the game, right? If the ref thinks
Yeah, and if there's a head injury, they automatically stop the game no matter what.
And that takes the onus off of everybody. You don't have argumentative parents who are wanting their kids to play. You're right, everybody wants to play. So the AD is the one that's calling the shots, and nobody can refute that, right?
Yeah, exactly.
How long has that been in play for now?
It started about 5 years ago. We started doing the concussion testing, but every year it's become more and more prevalent and very, very serious. And I think that all professional coaches realize how important it is. And I think that even in sports like football, my brother works in the NFL, and they're scared to death because they're afraid in time that they could end up banning football in time because they're really scared.
Yeah.
Really?
Yeah.
Wow.
Yeah. It's got to change. Keep the game. Yeah.
Wow.
I was gonna add one thing. I work with kids for many years now, but it's very important as a coach to know your kids that play for you, know what they can do and what they can't do. So that way, if they do have an impact, you know exactly because there's some kids that are more advanced than others. So if you're talking to a kid that has a speech problem or whatnot that currently has that, he's not going to respond to you that well. So you have to use other tools and methods to figure out where he's at. So it's important to know the kids that are on your team and how their abilities, so you can try to figure out the symptoms that they have on the field or on the court.
Good point. Very good. Know your kids, build that trust. Yeah. Anything else? Okay.
I mean, we here at the Y, for example, we applied where kids under 12, when they play soccer, not to use headers anymore.
Not to use
this
headers,
is one thing I think it's a great idea, even though, I mean, you can find it on a travel or, middle school or whatever. But I think it's one way trying to reduce these factors.
Yeah.
But you can have concussions from other things. For example, I've got a player sitting out now, He was defending, the player was dribbling down the line, hit a cross and hit him right square in the forehead, and he's been out for 2 weeks with a
Sure.
concussion.
Yeah.
So even if without the
Yeah.
heading.
Yeah, an
still-
elbow.
Oh,
yeah.
yeah, he got hurt.
In
You got the
basketball,
goalkeeper making
yeah.
contact with the player.
Yeah, it's just, yeah, when they're little, their brains, when they're young, their brains are still developing. It might cut down on some of those subconcussive.
So that is a
impacts.
national rule though now, you know, that they, because
National.
I'm not sure even when it started, but yeah, on the youth level, you cannot head the ball now until a certain age. Where in just a few years ago, I mean, that wasn't the case.
Yeah,
Every
exactly.
age could head the ball.
Yeah.
So I think it just goes in part to how you guys are saying how it is on the cutting edge, like we're just really, I think, starting to get into the bulk and the meat of everything.
Yeah, we're at a very exciting time, opportunity to make a difference. Anything else the coaches want to say, or?
I will
Nisha?
think, I think like the important thing too, just as an ex-player that went through a lot of concussions is, I think it's also just especially a fine line of, you know, I've worked a lot with parents and just kind of going in one other direction, right, of overly worried or concerned. And the point of why we're trying to talk to you guys, you know, tonight too, is to re-communicate how awesome sports are. And I think education is important, but it's also not taking it too far and just getting a baseline understanding so that we can still enjoy the sport and kids can still develop it. I'm sure that you would agree with that. But I think I see it more with, you know, the youth, just with, you know, overly concerned parents. And I think it starts with everyone here's understanding of what, you know, these things are, so you can help educate the parents as much as the players, so that they can develop properly and actually enjoy the game.
That's a good point, yeah, building the trust with the parents. They, let them know that you know you're about concussions and things, and the sport is still great. I mean, you know the skills, and you encourage their kids to play. All right, well, this has been great. Thank you all for your attention. Really appreciate it. I hope you have a great season, and I think we all enjoyed being here and meeting you. And if you have any questions, I have cards in the back, and please don't hesitate to reach out, okay?